Recently, my teeth had been grinding and they've been chipping away. I got concerned about it, so I began to look to see about going to a dentist. I'm newly arrived here. I've been here about 5 years. And as I'm passing through the facility here, I noticed the implant thing, and I had read something about it previously about 9 years ago when I lived in Hawaii. And so I stopped in to see what was going on. I had called and made an appointment, actually, and they had set one up, and I just got off work this morning and came straight here. And as we were talking and as we were looking at the images on the screen, he started telling me about what needed to be done. My first concern was whether I could afford it. Found out I could, so I said, let's do it. And I had those 3 implants done today.
Well, you have 2 infected teeth, and it's a second molar and a wisdom tooth on the upper left. And also he had 2 missing teeth previously back in Hawaii. He never had anything done there. So what I did is I proposed that he needs 3 implants, 3 missing teeth. We don't include wisdom tooth as the implant. It has a huge infection on the upper left, already communicating into the sinus, and he does have a little sinus problem in the morning, but he didn't know it was a tooth related. But after looking at the X-ray, I explained to him the infection already traveled all the way to the sinus floor. That more likely that's where the cause of the sinus infection. So I mentioned to him he needs also a sinus graft on top of the implant. And after I talked to him, he decided to do it today. And I just described to him how simple the procedure can be done within short of probably 40 minutes total. And so he decided that that's the way to do it right now, because he will not allow the infection to spread any further. The implants placed, and we just had to wait about 4 to 5 months. The other 2 implants actually can be ready to restore in 3 months, but the upper left where we did the sinus and bone graft and the implants simultaneously, due to so much bone loss and so big of a void that we had to fill in, looks like we probably need to wait about 5 to 6 months to get it done. Well, traditionally, that's what most of the people it's being invented back in 1977. It's what we call a window technique. What that means is you have to fracture the skull base to add a bone into the sinus floor. You wait 6 months and you place implants after that. But in his case, we had to take the tooth out at this, so we had to extract the tooth, let it heal, fill the bone with a socket, let it heal, sinus graft, this, that would be in the hospital setting, let it heal. So total already about a year and a half before you place the implant. And after you place the implant, you need to wait 4 more months. So by the time he really enjoy able to chew and restore that crown, takes about 2 years. What I did is I went ahead. I feel there must be an easier way to do it. So what I did is throughout many years of experience and try to figure out how to elevate that sinus floor, I was able to invent a way to introducing a water pressure. The water pressure will loosen up the sinus membrane, and at the same time, I have there's a little condenser that I can push the synthetic bone into the sinus floor, and all can be done within 15 minutes.
When I used to go to my dentist here every 6 months, 10 years ago, he had gone to a seminar to learn how to do implants. He suggested that I should try one. And I was kind of reluctant because I said, well, you're just learning. I don't think I want to be your specimen here. And I just happened to leave the area and come to Las Vegas. I saw my teeth being chipped away slowly, and I said, I better start doing something about it. And I feel like I want to be able to chew my own food until I'm ready to die. I mean, I don't want to ground up in some blender and suck it out of a straw. Well, one of the things that they put you at ease, or doctor put me at ease, and the procedure was so non-invasive. There was no pain, there was no, I didn't even taste any blood, which is one of the things that amazed me. And there was no spittoon. For me to be spitting anything out, I thought this is totally new procedures and new technology. Take advantage of it. It's here. None of them, in fact, none of them were, let's do it, and pushy. They were just telling me, and then they'd leave and let me make up my own mind.
Normally, a lot of people usually get a couple interview with different other doctors, and they hear different techniques, and by the time they get here, they kind of make up their mind. But these are very typical patients that decide to have implants at the same time